Hello everyone and welcome to week 10. This week is actually one of my favorite weeks as we really get into a topic I love, which is phlebotomy. Now I know maybe some of you are not looking forward to this unit in your your lab classes, but by the end I promise you will really like that. So this week our focus is on two chapters, chapter 44 and chapter 47. Now I'm going to start with chapter 47 and then I will back up and finish with chapter 44 this week. So chapter 47 is focused on phlebotomy and blood collection. And you may hear me throughout the video say phlebotomy or venipuncture, but please know that these refer to the same thing. So when we are talking about phlebotomy, it is the collection of blood through a tiny incision in the vein, and that's typically done with what we call a hollow needle. Starting off, we need to discuss what your role is as a medical assistant in this procedure. And your role will be to properly collect, label, and even possibly process or store the specimen. In order to do this, you need to have a basic understanding of the circulatory system, the equipment used, the term asepsis, venipuncture procedures, and all that entitles. So you actually learned about asepsis quite a few weeks ago, so I'm going to not focus on that in the video, but I will focus on the other three aspects. So let's get started with the circulatory system. The circulatory system is important to understand because it has the basics about the heart, blood vessels, and blood itself. The heart has one main job, and that is to pump and keep blood moving. Blood vessels, their job is really to provide a one-way travel route around our body and back to our hearts. Now, there are some other key players that help with that process, such as arteries, which is where your blood will leave the heart. Okay, arteries have thick, elastic walls, which feel very much like kind of a hard rubber surface. And the blood in those carry bright red blood. Arteries also have a pulse, which makes them very easy to distinguish. Next, we have our capillaries, and they really act as kind of a gas station for your blood. They fuel your blood with oxygen. So oxygen is delivered from your arterial blood to your cells, and then the garbage, or the carbon dioxide, is removed from those cells and carried into your veins. So then the final player, obviously, is your veins. Their job is to carry blood back to the heart. First, it will be delivered to the lungs, where it can kind of drop off that carbon dioxide for us to breathe out, and we then supply the blood with new oxygen that we breathe in. The veins have thinner walls and they feel very spongy, kind of like a bouncy ball, and they are similar to what you would feel like if you were on a trampoline. The blood then found in those is kind of a darker blood. It almost has like a dark red color to it, but if you look at it, it's much darker than that of your arterial blood. So next we have our phlebotomy equipment. So there is a wide variety of equipment used for phlebotomy procedures depending on which one you are performing. You will need things such as blood collection tubes, which are also called evacuated blood tubes, and they're designed to automatically withdraw the exact amount of blood needed for testing. Each tube color is coordinated to the anticoagulant or additive that is found within it. And these devices can either be glass or plastic, but plastic is really more preferred for safety reasons, both for the medical assistant and the patient. You will also use double-ended needles, where the tip of the needle is also called a bevel, which is where you have that cut at a slant. In any of these procedures, remember that the bevel needs to face upwards towards the sky in order to properly collect a sample. The lumen is the space at the inside of the needle, and this is where we get our gauges. Typically for blood draw, we use somewhere between a 20 to a 21 gauge needle. You will use tourniquets to help you collect your sample. These are elastic bands that should be placed about 2 to 3 inches above the puncture site and only should stay on for 1 minute. Any longer and it starts to actually make your blood sample inaccurate. You want to have your tourniquet tight enough so that it stops venous blood flow but still allows arterial blood flow. You'll use tube holders as a plastic device at the end of your double-sided needle to hold the tube in place. And you will use syringes for some blood draws, and these can vary in shapes and size. All right, let's talk about the procedural part of this, the things that you really want to talk about. The procedure can be performed in several areas of your body, but the most common is the antecubital space or that bend in your elbow. And we use 3 main veins for this procedure: the median cubital, the cephalic, and basilic. The median cubital is the most popular and it's typically the largest and is found right in the middle of your antecubital space. The cephalic vein is the second most common. It's not as large, but it is still pretty well anchored. It's found on the outer edge of the thumb side of your antecubital space. And the basilic vein is really your kind of last option. It's not very well anchored, and it's directly above your brachial artery, so you want to try to avoid this one as much as you can. And this vein is located on the outside edge or the pinky side of your antecubital space. So now that we know where this procedure takes place, what equipment you use, let's discuss the 3 different types of venipuncture. And we're going to start with the most common, the vacuated tube method, or the vacuum tube method. It's the most common because it allows for multiple samples to be obtained at the same time without having to stick the patient multiple times. The vacuum tube is placed to take the exact amount of blood that is needed for the sample and will stop filling when it is full. Next, we have your butterfly method, also known as the winged infusion method. It's a needle that attaches to tubing, and at the end of the tubing, you can put a syringe or a tube holder for evacuated tubes. Typically, we use this method for when we have small veins that are difficult to draw from, or for children. And the final method is a syringe method. This method is used to collect samples from small, fragile veins that cannot stand the pressure of the evacuated tube method. The drawback to this method is that the amount of blood that can be drawn is limited to the size of the syringes. So in any of the methods above that we just talked about, it's important that you understand the order of draw. The reason that the order of draw is so important is because it helps to keep bacteria or skin infections from mixing with other additives. So really what that means is we want to avoid cross-contamination. As you can see here, we have the rainbow of effects, and it starts from the light blue top tube, and it will go all the way to your gray top tube at the bottom. I'm going to leave this section for you to read on your own in your chapters and the use of your lab classes. The last thing I want to discuss for chapter 47 is a capillary puncture. This is also called a skin puncture and is used when a very small amount of blood is needed. The appropriate sites for adults are the middle or ring finger, so your 3rd and 4th digit, on either hand, but preferably the patient's non-dominant. When you use the fingers, you want to use the outside fatty edges. We can also use the earlobe as another option, but typically you stick with just the fingers. You'll need to use a lancet with which is a device that contains a needle inside of it. And the recommended depth for adults for this puncture is 2 millimeters. You never collect the first drop of blood from the patient. You always wipe that away because it does contain tissue fluid that can dilute your sample. You also, for children, you typically under the age of 1 will use their heels, not their fingers, partly because those aren't developed enough and they don't have that fatty tissue. And for them, the recommended depth is about 1 millimeter. All right, the last part of chapter 47 that I'm going to discuss is going to be the 2 types of collection devices for capillary punctures. So capillary tubes are designed to help you pull blood into the opening of a tube. They can be glass or plastic. Again, plastic is preferred. Ones that are blue tipped typically have no additive within them, and the red tipped means that they have heparin to prevent blood clotting. Microtainers are typically smaller versions of evacuated tube colors, and they work just like the evacuated tube does. All right, so chapter 44 is talking about the clinical laboratory and its importance. It's helpful to know that not only physicians, but also patients, by providing this information. And the labs are really good because it helps you kind of confirm diagnoses, maybe screen for diagnostic procedures or diseases. It really helps to rule out conditions and set baselines. And laboratories fall into 2 categories, either qualitative or quantitative. It's also important that you understand the Improvement Act called CLIA, which was put in place in 1988. And it's really a way to help create safety policies and procedures for patients. And it really partnered with OSHA to learn a whole lot about how to really help safeguard patients. OSHA is something that we've talked about many times, so I'm not going to talk about that again here in this video. And final piece here is talking about quality assurance versus quality control. Quality assurance is responsible for helping to carry out procedures that involve planned and systematic activities to ensure that the requirements are met and results are accurate. Quality assurance will include quality control, orientation, documentation of controls, quality checks on equipment and instruments, calibrating of instruments, temperature checks, checking expiration dates, and proficiency testing. Now, quality control is where we actually have a reference value that we refer to, or a normal value that we refer to, and it's focused on really the physical proof that results are accurate. This can be done with calibrations or controlled solutions. All right, guys, so that's kind of where I'm going to end the video. I know it's a lot, so please make sure, as always, that you are reading your chapters, both 47 and 44 in full, so you get the full information for both of those chapters. This week, you do have one initial discussion post, which is talking about the importance of the order of draw. As always, your initial post will be due on Tuesday by midnight. So this quarter, that is September 5th by midnight. And when you're looking at your discussion posts, you need to answer 2 questions. You need to explain why it's so important to follow the order of draw and what happens if that is not followed. And second question is, do blood collection tubes need to be filled completely? Why or why not? Okay. You'll need to make sure that you reply to at least one classmate no later than Saturday, September 9th by midnight. And then you'll have your quiz this week, which will be due September 10th by midnight. If you have any questions or concerns, please make sure that you reach out to me, guys. I am available via email or phone. Bye, everybody.